Hi, today we're going to talk about the introduction to human anatomy and physiology. Let's start with some basic terms. Anatomy is defined as the structure and the relationships among these structures, versus physiology refers to the functions of these body parts. So in order to study anatomy, we need to dissect the human body. And so dissection means the careful cutting apart of these body structures in order to study anatomy, which anatomy is the study of these structures and relationships to each other, versus physiology is the study of how these body parts function and how they work together. There is a close relationship between anatomy, between structure and function, or anatomy and physiology. You can see in this example, the skull sutures are designed in a very special way to protect the brain, where the vertebral body surrounds in the vertebral canal the spinal cord and acts as also a protective covering around it. We have to learn some other basic terms. We have to know the differences between macroscopic anatomy versus microscopic anatomy. So macroscopic anatomy, or gross anatomy, means that we could see these structures with the unaided eye. For example, in this situation, we could see skeletal muscle on this weightlifter. Versus microscopic anatomy, we do need some type of magnification in order to see, for example, the sarcomere, which is the functional unit of skeletal muscle. So microscopic anatomy is where we need magnification. There's a variety of tools we use for this versus a light microscope or an electron microscope, where we could see things to a greater degree. Some other terms related to anatomy, we talk about cytology. So when you see the suffix ology, that means the study of. So cytology is the study of individual cells. We will study cells in the next time we meet. Histology is the examination of tissues, and embryology is the study of fertilization between the first weeks of life. When we study gross anatomy, gross means that we can study the structures without an unaided eye, and we divide this up in different regions. So surface anatomy is a region where we could study the internal structures and how they relate to underlying skin. So for example, let's take our elbow. The external skin, underneath that skin, there's going to be muscles and connective tissue. Underneath that, we will see tendons, ligaments. Underneath that, we can see joints and bones. So all that is related to surface anatomy. Regional anatomy is all the structures related to one part of the body. For example, the head and neck, the lower limb, the upper limb. And then systemic anatomy means organ systems. For example, the digestive system, all the organs associated with that, the respiratory system. Developmental anatomy refers to the anatomy from fertilization to death. Embryology is the study of the development from fertilization to the first 8 weeks in utero. Certain specialized branches, which will include pathological anatomy, which refers to the study of structural changes caused by disease, path, and radiographic anatomy is the study of internal structures that are seen on x-rays. So how do we, well, after we take a history on a patient, there are non-invasive diagnostic techniques. What does that mean? It does not involve the insertion of an instrument device through the skin or body opening. So the easiest and the first thing that we could do is called inspection. What does inspection mean? You're observing the body for any obvious changes from normal. So what could you see on inspection? Any kind of swelling or inflammation, any redness, any color changes in the body area that they're referring to, any wounds, any type of lesions. Palpation is where the examiner touches that area with their hands. So what could we see with that? What could we feel? And we should read together so we can talk about this. But some examples of palpation will be you could feel a nodule, you could feel heat, you could feel cold. So it's all based on the examiner feeling the area that is involved. Auscultation means the listening of the body for sounds, often with the use of the stethoscope to amplify these sounds. What can you listen to? Obviously will be the heart, lungs, the abdomen. The fourth one is percussion. So percussion is a similar process where you're listening for sounds, but this is where you're tapping the surface of the body with your fingertips, listening for an echo in these regions against the abdominal cavity or the lungs. So inspection, for example, in this situation, examining the mouth for redness, whiteness, inflammation. Palpation, in this situation, you're palpating the neck for lymph nodes that are swollen, which can indicate a virus, an infection. Auscultation with the use of a stethoscope or listening to the lungs or the abdominal cavity. Percussion, same concept where you're listening for an echo of these regions pertaining to the lungs or the abdominal cavity. So next, let's talk about the levels of body organization. So the levels of body organization start from chemical level, which includes atoms. Two or more atoms is called molecules. So they go from smallest to largest. So these molecules combine to form cells, and this is going to correlate with many of the chapters that we will be studying throughout the semester. Several cells will form tissues. Two or more tissues form organs. Several organs will form systems, and the entire system will become the organismal or the human body. So let's look at these in a little more detail. So we're thinking about the chemical level, and this letter, word, sentence, paragraph, chapter, and book is something you could relate to how it is related in your textbook. So the chemical level is the smallest units of matter that participate in chemical reactions. Two or more atoms will make molecules. So these molecules are essential for life, and they combine to form cells. So the basic definition of cells is that they are the basic structure and functional units of the organism. We'll talk about cells in greater detail next time we meet. So several cells or groups of cells combine to form tissues, and we'll talk about different types of tissues in the next few chapters, which will include epithelial tissue, connective tissue, muscle, and nervous tissue. So different types of tissues are going to form organs. Two or more different types of tissue form organs such as the heart, the liver, the brain, the lungs. And then related organs with a common function will form systems. And that's when we'll talk about digestive systems, respiratory systems, cardiovascular systems, and then the entire group of systems all function together will end result of the human body functioning with all these systems functioning together. So here we are with the atoms. Two or more atoms will form molecules. So molecules will combine to form cells. So we have a whole chapter next time on cells. So several cells form together to form tissues, and different types of tissues will combine to form an organ. So in this situation, you can see the stomach. It's formed from epithelial tissue on the inside, connective tissue around the outside, and smooth muscle tissue within the stomach itself. So separate organs with a similar purpose will form systems. In this situation, we can see the digestive system, which will include the mouth, the esophagus, stomach, small intestine, large intestine, rectum, and then the entire group of systems will combine to form the human body, or the organismal level. So now we're going to go into each of these body systems in generalities. We have 11 body systems. We're going to go through most of these in more detail throughout the semester. So let's start with the integumentary system. This is actually one of the largest or heaviest system in our body. This is going to form the external body covering. It's going to separate our external environment from the internal environment, and it's going to include hair, sweat glands, nails, skin, and of course the major function is for protection against environmental hazards. It's also important to regulate body temperature. It's going to assist with eliminating waste and sweat. It's important for processing vitamin D, aids in sensation and detection, and also stores fat for insulation. The skeletal system will include bones, cartilage, and joints. Some of the functions of the skeletal system will include supporting our body posture. It's going to protect. It has the surfaces for muscle attachments, which will aid in body movements. Within the skeletal system or bones, we have the ability to produce blood cells, store minerals, and lipids. The muscular system is associated with the muscles and tendons. The function of this is going to enable movements through contraction. It's going to enable us to move. It also aids in supporting other tissues and generates heat through shivering to maintain our body temperature. The cardiovascular system includes the heart, the arteries, and the veins. The heart's pumping blood systemically, bringing nutrients and oxygen to all our tissues. The veins are reabsorbing carbon dioxide in order to expel this from our body through our lungs, through respiration. Other important factors is it's going to regulate our acid-base balance, temperature, water content of the body. It helps defends us from disease and repair of damaged blood cells. Also distributes heat, which assists in the control of body temperature. The lymphatic system and the immune system will include several organs, which will include the lymphatic vessels, which travels along with the circulatory system, bone marrow, tonsils. The main function of the lymphatic system is, of course, the immune system, but also helps in returning proteins and fluids back into the circulatory system. Through the gastrointestinal system, carries lipids from the GI tract to the blood. Throughout the lymphatic system and in the lymph nodes, we have T and B cells, which protect us against diseases and microbes. We know that when our lymph nodes are swollen, they're actually fighting off either bacterial infections or viral infections or something a little more serious like cancer. The nervous system will be a fun chapter. We're going to talk about the difference between the central nervous system and the peripheral nervous system. The central nervous system includes the brain and the spinal cord, and the peripheral nervous system includes everything else outside of that. The functions, it's going to regulate body activities, generates action potentials, and also is important for detecting and interpreting the external environment and the internal environment. The endocrine system is a main regulator of activities by releasing hormones. Hormones are chemical messengers generally transported from the blood, in the blood from endocrine glands to tissues and target organs. An important one you want to note for your exam is the pancreas. We'll learn shortly that the pancreas has two functions. It has an endocrine function, which regulates our blood glucose, and will also have a digestive function, which we'll talk about in a minute. The respiratory system will include the nasal cavities, the sinuses, larynx, the trachea, the lungs, the bronchi in the lungs, and the alveoli. The function of this is through the alveoli will transfer oxygen through inhalation into the blood and eventually into the cells, where at the same time CO2 is absorbed from the blood and expelled out of the lungs. Also regulates, with this process, regulates acid-base balance and body fluids. And in this oral cavity also produces the vocalization or the enhancing of sounds for speaking. The digestive system is the system we have where we can process, for example, an apple and break it down into small molecules where we could absorb the nutrients so we can use this for our activities that our body needs. At the same time, through absorption of the nutrients, we have the ability to eliminate the wastes out of the anus as feces. So the pancreas sits behind the stomach, and it has both endocrine functions and also digestive functions. The pancreas will digest pancreatic juice into the duodenum, which aids in further digesting the food that is being processed through the digestive system. The urinary system will include the kidneys, the ureters, the bladder, and the urethra. It's the process that we store and eliminate urine and waste out of the body. It regulates the volume and chemical composition of blood, also helps maintain acid-base balance of bodily fluids. So we already discussed that the respiratory and now the urinary system help maintain our acid balance. So again, here we have the kidneys, the ureters. So the kidneys are the main region through the nephrons that filters the blood and any waste products that are processed in the kidneys will be dumped into the ureters. So the urine in the ureters eventually ends up in the urinary bladder, and the urinary bladder will hold this urine until its capacity is a little full and it becomes uncomfortable, and then we have to eliminate this through the urethra. We'll talk about the reproductive system. In the female, the sex cells and hormones are produced by the ovaries. The uterus supports the developing embryo, and the mammary glands provide nutrition to the newborn. The reproductive system in the male will learn how in the testes produces the sex hormones and also the spermatozoa, which are necessary for reproduction, and the storage of these gametes in the testes until into this in greater detail. So this is a review of most of the systems that we will cover in this class this semester. Some other terms that we've talked about in the past, for example, homeostasis. All these systems are set up that their systems are in a continuous state to maintain homeostasis, which means the tendency of the human body to maintain a condition of balance and equilibrium. For example, when we get cold, our skeletal muscles will contract and shiver, which will increase our temperature to balance that out. The same time when we're too hot, the opposite occurs where we begin to sweat, and that sweat can cool us off to maintain that temperature. So let's discuss in general some other terms we have to learn. So the life processes for living organisms have certain characteristics that set us apart from non-living things. What does that include? Metabolism. So the metabolism is the ability, like through the digestive system, is that where we can break down large complex molecules into smaller ones so we can reabsorb them for nutrition. So that breakdown is called catabolism. And anabolism is the building of complex molecules from these smaller ones. The human body has the ability for responsiveness, or living organisms. What does that mean? That we have the ability to respond to changes not only in the internal or external environment. Movement is where, versus on a whole body or cellular level, we have the ability for motion. Growth means the increase of cell size or the material around us. Differentiation is the process of unspecialized cells to become specialized cells. An example of this are stem cells. And reproduction is the formation of new cells through cell division. So the first one is organization. So all living things have complex organizations. The brain, as we will learn, is very, very complex, organized in compartments that control specific functions. Movement, everything that is alive moves to some level, either the whole body movement or on a cellular level. Growth and differentiation occurs through our inherited genes determine the organism's pattern of growth and development, whether it's a human baby, a kitten, a puppy, we have this ability for growth and differentiation. Metabolism is the ability to break down a protein small enough where we can absorb it and use that protein in order to develop, for example, in this case, skeletal muscles. Response to environmental stimuli, for example, if we're going to touch a hot pot, we could feel it's hot, immediately release it, hopefully avoiding injury. Thermotaxis, chemotaxis, phototaxis occurs on different species. Plants, as you know, sometimes if you put it in a certain room, it'll like bend towards the sunlight. Reproduction through evolution, so differential success of reproduction. So the evolution defines the success of how many copies of your genes are in successive generations. All right, so let's talk about some more terms that are needed as we go through this semester. I would highly recommend you take some time and look at these images, not only in the PowerPoint, but also in your textbook and notes, and start learning a lot of these terms. Anatomical position, which we'll talk about throughout the entire semester, includes the human standing, facing forward, the feet, a little bit of external rotation in this position. And the important part is where your palms are facing forward. So if you put your palms facing forward, your thumb is going to be superior and your fifth phalange or fifth finger is going to be inferior. So the palms in this situation are facing forward. So we're talking about anatomical position, we will always refer to this. Let's talk about some other terms. I'm not going to read all this to you, but I'd like you to start talking about, for example, the head is the cranial, the face is the facial, chest, we'll call it the pectoral, the center of the chest is the sternum. So if we start memorizing and learning these terms, it's going to be simpler when we discuss about the pectoral muscles, sternum bone. This region here is the abdominal region. The center is the umbilical. Posterior, the back of the neck is the nuchal. Shoulder blades we'll call scapula, which these are the scapula bones. The vertebra will be the vertebral. We'll talk about the different regions, which the neck is cervical, the mid-back is thoracic, the low back is lumbar. We've got the sternum and the coccyx. In the legs, the anterior leg, the thigh right here is called the femoral. The lower leg here is the crural. Tarsals, the calcaneus is the heel of the foot. So other terms that we will refer to are supine. So supine means you're lying on your spine. That's how I remembered it. We're prone, you're on your stomach, it's down. Now we refer to the back, we'll call it the real name. So the neck is the cervical, mid back is the thoracic, low back is the lumbar. This bone is the sacrum, and the little tailbone is called the coccyx. So let's memorize how many bones in each. So the way I memorized it is we have breakfast at 7 a.m. So we have 7 cervical bones. We have lunch at 12 p.m. and we have 12 thoracic bones. We have dinner at 5 p.m. So we have 5 lumbar bones. There's 1 sacrum and 1 coccyx. So again, this refers to the different regions: axillary, armpit, brachial, antebrachial. The carpals will be the hand. The thumb will refer to as a pollex, where the great toe is the hallux. So I'd like you to review these, maybe draw a little figure and name this. And this is going to help you to a great extent when we get to each of these individual regions. Excuse me. The foot, the pes, big toe is the hallux. The bottom of our foot is called the plantar. I don't know if you've ever heard of plantar fasciitis. These are the phalanges. We have phalanges in our toes and also in our hands. The heel is the calcaneus. So please go through that on your own and start memorizing those. So the way we understand the human body is the anatomical directions. So anything in the center, closer to the center, is the medial region, and anything away from the center is called lateral. So anything closest to the center of the body is medial, Anything away from the medial is called lateral. The front of the body, of course, is called anterior, but we're going to call it's going to be synonymous with ventral. So anterior and ventral are going to be similar. Posterior or dorsal will be similar. So make sure you start learning these terms. When we start studying neurology, we refer to things in the ventral anterior or dorsal or posterior manner. Cranial, anything closer to the head, versus caudal, anything closer to the tailbone. Front is superior, anything below is inferior. So these are general terms we'll start to use. When we talk about proximal and distal, it's only associated with the arms or the legs. Another term for this is the upper extremity or the lower extremity. So the fingers are distal to the shoulder, or the shoulder is proximal than the fingers. Same thing with the hip, the knee, or the ankle. So sectional anatomy refers to planes. So what is a plane? It's like an imaginary cut that passes through the human body. So we have to understand these different planes. So when we see a sagittal plane, it means we're dividing the human body in a right or left side. So this would be considered a mid-sagittal plane. And you could see how it looks like. If we could take a cut and dividing the body into right or left side, this is the image we would see. Mid-sagittal plane is exactly equal, right and left sides. Another plane would be the frontal plane or the coronal plane. So the frontal plane is this purple one. This divides the body into anterior and posterior divisions. And you could see right here in the frontal plane, if we could take a slice this way, you could see this image. And the last one, that didn't come out on this image, is the transverse plane. So the transverse plane is also known as a horizontal plane, and that's dividing the human body into a superior and inferior separation. So let's look at the divisions of the brain here. Transverse plane, remember, it divides the organ or the human body into a superior and inferior, right? And this is going to also be called as a horizontal plane. Okay, sorry, it's hard to draw with this. A frontal plane divides, in this situation, the brain in between an anterior and posterior, and you'll also see this as a coronal. Division. Okay, sorry, it's hard with this. And then a sagittal plane, so this is in anterior and posterior, right? And a sagittal plane will divide the brain or the human body into a right and left side. Make sure you understand this. You can see images of this and also understand the terms. So again, going over the directional terms, anything in the midline, anything towards the midline, we call it the medial. Anything away from the midline, we call it lateral. Okay. In the upper extremity or lower extremity, we use only the terms proximal and distal. We'll also use superior and inferior. So, for example, the urinary bladder is inferior to the stomach, correct? let's talk about something else, like the heart is medial to the lungs, correct? Or the lungs are lateral to the heart. The carpals, or the wrist bones, are distal to the elbow, or the shoulder is proximal to the elbow. So let's talk about body cavities. So body cavities, we have 3 regions that we have to talk about with the body cavities. So the first one is called the cranial cavity. So the cranial cavity will include the cranial cavity and the vertebral column are considered posterior or dorsal. Okay. And the cranial cavity houses the brain, the vertebral canal houses the spinal cord. Then we've got 2 cavities that are considered anterior. Remember, another term for anterior was ventral. So the anterior or ventral cavities includes the thoracic cavity and the abdominal pelvic cavity. So we'll learn that the thoracic cavity is divided into little subunit cavities, which will be the pleural cavity here, houses the lungs, right? Pericardial cavity houses the heart here. And then in between the 2 lungs is another cavity called the mediastinum, which concludes the pericardial cavity and a lot of other organs that will, vessels that we'll talk about in a minute. The abdominal cavity will have a lot of our abdominal organs, and it also includes the pelvic cavity, which includes some of the digestive organs, the genitalia, the urinary bladder. What separates the thoracic cavity from the abdominal pelvic cavity is the diaphragm. The diaphragm is actually a muscle that is a big part of the respiratory system. So the diaphragm separates the thoracic cavity from the abdominal pelvic cavity. So the cranial cavity and the vertebral cavity are considered posterior or dorsal. Of course, the cranial activity contains the brain, and the vertebral canal contains the spinal cord, which has the beginnings of the spinal nerves. The thoracic cavity contains these 3 subcavities. The pleural cavity surrounds each lung, and it has a serous membrane, which we'll talk about in a minute what it is, and it has a pericardial cavity that also has a serous membrane around it, and then the mediastinum, which is an anatomical central portion, which will include everything aside from the pleural cavity. So that'll have the pericardial cavity, which includes the lungs. We have the vessels that come off of here, also the esophagus in this region. The arteries and the veins are coming off of the pleural cavity, and the thymus is all considered part of the mediastinum. The abdominal cavity, abdominal pelvic cavity, is divided into an abdominal cavity and a pelvic cavity. The abdominal cavity contains most of the digestive organs, where the pelvic cavity will have some digestive organs, the urinary bladder, and the reproductive organs. So a serous membrane is a slippery membrane that covers the organs and also lines the walls of each cavity. So if you can imagine the lungs, it's going to have like a slippery somewhat of a fluidy membrane around the outside. So when the lungs are contracting and relaxing, it's not like dry tissue bumping up against a cavity. Other terms we have to know is these thoracic and abdominal organs have layers. The parietal layer is a serous membrane that lines the walls of the cavities, where a visceral layer is a serous membrane that covers and adheres to the viscera or the organs. So let's talk about the thoracic cavity. The thoracic cavity is subdivided into a pleural cavity that houses the lungs, pericardial cavity, and then this whole thing is considered the mediastinum, which is everything in between here, excluding the lungs. So let's look at these serous membranes. Remember, the parietal pleura was the serous membrane around the outside of the cavity, and the visceral pleura is the serous membrane right on top of the lungs. So there is a little space in between those two pleuras, and that's called the pleural cavity. What's in here is some serous fluid. It's like a slippery fluid this way when the lungs are moving, contracting and inhaling and exhaling, lots of movement. There is some fluidity in here, so it's kind of is a shock absorber. Here's the pericardial cavity. Around the outside, we call it the parietal pericardium, which is a serous membrane around the outside cavity. And then we have the visceral pericardium, which this is a thin layer of serous tissue right on the heart itself. And within the cavity, there's serous fluid. So let's look at cadaver portion of this. Here you can see the lung, okay? This is particularly the right lung. So right on the lung tissue, we have the visceral pleura. Right on the outside of the pleural cavity, we have the parietal pleura, which is the serous membrane around the outside. And in between the two, there is a pleural cavity, which is a little space that will have serous fluid in it. Let's look at the pericardial cavity. So right on the heart itself, it's called the visceral pericardium. Around the outside of this pericardium is the parietal pericardium. And the pericardial cavity is the little space that contains some serous fluid. Again, here is the lung. Okay. The visceral pleura is that serous membrane right on the lung. The parietal pleura is this thin tissue on the outside here. And then in between the lung and the parietal pleura is that space that has the serous fluid. This is a nice example of the heart. You can see the visceral pericardium right on the heart tissue itself here. Here is the parietal pericardium. You can see this really thin layer of serous tissue around the outside. And then in between, we have the pericardial cavity. So the abdominal pelvic cavity, which is separated from the thoracic cavity via the muscle called the diaphragm, which we'll learn is an important respiratory muscle. In the abdominal pelvic cavity, we could see serous membranes inside of it, which surround each of these organs. Therefore, when the organs are functioning, there's a lot of serous membrane inside of it. And this is separated into the pelvic cavity and the abdominal cavity. So let's talk about the abdominal pelvic regions. We can study these in two ways. One is 9 regions, and it's important to learn this. How would be the best way to do this? Just draw like a little tic-tac-toe. like this. Memorize it. We're going to ask you questions on this. So the center is called the umbilical, right? Right here near the belly button, or the umbilicus. Above the umbilicus is called the epigastric region. Below it is the hypogastric, okay? When we're referring to right or left, we always refer to the model's right or left, not your right or left. So in this case, this is called the right lumbar because it's the model's right side. So this is the right lumbar, and this one would be the left lumbar, okay? So above here, it's called the hypochondriac region. This would be the right, and this would be the left. And here in the inguinal, this would be the right inguinal and the left inguinal. So always refer to your manual. You'll see a few other names for this, which I'll show you in a minute. So again, as we study the abdominal pelvic region, we also want to learn some of the organs that are in this region. So for example, that epigastric region, what do we see here? We can kind of see the stomach. The left hypochondriac, you can see the liver. The right hypochondriac, you see the spleen. The gastric region, you could see the urinary bladder. Lumbar, areas of the ascending and descending colon. So in your text, I know it calls it the hypogastric region. You'll also see it called as the pubic region, the iliac or the inguinal region. Okay, these are different names. Always refer to your lab manual in terms of what we're going to use. Another way to look at the abdominal pelvic region is 4 quadrants. So this is easier to memorize because you're just going to draw this. And you'll see it as an abbreviation of right upper quadrant. Again, it's the model's right side, and left upper quadrant, or left lower quadrant, and right lower quadrant. And also get an idea of what organ. So right upper quadrant, we could see the liver here. Left upper quadrant, the big one is the stomach. Right lower quadrant, this has the vermiform appendix. So often an appendicitis will have some right lower quadrant pain. Left lower quadrant on a male, it could be an inguinal hernia right here. On a female, it could be an ovarian cyst. So that's how we have to start looking at this, not only to memorize the names, but what organs are underneath these regions. So let's look into more terms that we have to know. Human body and disease. So when we see the term disorder, this is a general term that refers to any abnormality of anatomy. It's very general, where a disease is a more specific term for an illness, and it has a set grouping of symptoms. So what is a symptom? So we do have to know these definitions. Symptom is a subjective change. What does that mean? For example, a patient comes in and tells you they have a headache. Can you prove that? Probably not. They're nauseous, they're anxious. So these are what we call subjective changes. So a symptom is subjective, meaning the patient tells you have it, but it's not. You cannot prove it. A sign has objective changes. So what is a sign? Where you can observe and measure this. You can measure it anatomically or physiologically. So what's an anatomical sign? This is where we could see a lesion. We could look at a rash. We could also see and palpate swelling. You could see a wound. You could palpate a tumor. You could see an ulcer. So these are anatomical signs, or objective. You can actually see this. Physiological signs are signs that you can measure or prove. So you can measure fever, you can measure high blood pressure. Also, a um, local sign would be a small part of the body, for example, a sinus infection, versus a systemic disease will travel. For example, an influenza. They'll have a temperature, their nose will be running, they'll have like body aches. So there's a difference between local and systemic. So other terms we have to learn are, for example, an epidemiology is the study of why, when, where, and how disease. Pharmacology is the use of drugs and understand how they work through action and binding and how they can help. And the diagnosis means distinguishing one disease from another through differential diagnosis, understanding their medical history, and performing exams. So I included this. We can't talk about disease without kind of referring to the COVID. In general, this is from the Center for Disease Control. Some general symptoms, which can include a cough, a fever, some chills, muscle pains, often sore throats, loss of smell or taste, shortness of breath. How do we stop this? Of course, we want to stay 6 feet apart, cover your nose and face if you have to sneeze, wear a mask, wash your hands, and stay home when you're sick. So these are generalities that you can refer to. So how do we evaluate a patient through medical imaging? We're going to go over a few, not all. So for example, an X-ray. An X-ray is two-dimensional, very inexpensive, and it's the X-ray passes through the body, producing an image on X-ray sensitive film, often used as a first diagnostic tool after injury to rule out any kind of fractures of bones. Something more advanced would be an MRI. So an MRI, or magnetic resonance imaging, an MRI is based on, it's a large magnetic device which energizes or aligns our hydrogen atoms in tissues. So it produces an image from this. It's very good at looking at soft tissue, two-dimensionals, for example, to look at brain tumors, to look at intervertebral discs. CT or CAT scan is a form of X-ray. It's much more sensitive than an X-ray itself, and it gives us a three-dimensional image of what we are looking at, and the resolution is much better than X-ray, so it's more sensitive to look at fractures. Coronary computed tomography, angiography, is where iodine-containing contrast is injected into the veins, and also a beta blocker to decrease the heart rate, and it creates a three-dimensional picture around our coronary arteries, which is a separate little circulatory system around our heart to rule out any blockage. Ultrasound, those of you who've had a baby, you know that ultrasound is safe for the growing fetus, and it's a way we can show how the fetus is developing through sound waves striking tissue of different densities, producing characteristic echoes, which can be recorded as an image. A PET scan often is used in conjunction with chemotherapy, and a PET scan visualizes metabolically active cells using a radioactive glucose. Therefore, it can tell us if, for example, a tumor has, begun growing, and it's very sensitive for that. Radio nuclide scanning also is a way to visualize metabolically active cells. Other studies that are often used are, for example, an endoscope. So an endoscope is the way we could look inside the body using a flexible tube attached to a scope and camera. An endoscopy goes in through the mouth to look at the esophagus and the stomach, versus a colonoscopy is going in through the anal canal and looking at the large intestine to look at the tissue. So let's look at some of these images. This is an X-ray. Excellent to look at bones. Often you only see a two-dimensional image. In this case, you could see a dislocation and possibly a fracture here. Mammogram, bone densities or form of X-rays. Mammogram, of course, we're detecting breast cancer. Bone density examines generally a woman's lumbar spine and hips to check for osteoporosis. Angiogram, this is where a dye is inserted into the coronary arteries to rule out any kind of blockage. A urogram also in the ureters to detect blockage or tumors in that area. MRI, ideal to look at soft tissue like the brain, also the intervertebral discs for herniations. This is the PET scan. So again, we talked about how the PET scan visualizes metabolic activities using radioactive glucose. So therefore, it's providing information regarding the tissue function. It provides a picture of if some of the cells are metabolically active, which you could see them in red. CT, you could see a tumor in the brain here, more sensitive than X-ray. Often CT will give us a three-dimensional perspective and a better resolution than conventional X-rays. Biopsy is often used where we're removing a sample of living tissue to microscopically evaluate it. So check if there's any infection or cancer in that area. We talked about microscopes. So we can see microscopic anatomy through microscope. The ones that we most commonly see are light microscopes. So this is visible light passing through the cell. A little more advanced, which gives us two-dimensional images, would be transmission electron microscope. And then even a greater evaluation would be the scanning electron microscope. So this will provide us a three-dimensional image of the cell surface. So here's the difference with what we could see with a microscope and an electron microscope, and the differences here between the transmission electron microscope and the scanning electron microscope. So here's the light microscope. We could see at a level of 720 times, where the second type, which would be the transmission electron microscope versus the scanning electron microscope, you could see to a greater extent in three-dimensional and two-dimensional images. So we are done with our introduction class.